Liposuction is a procedure that uses small incisions to extract fat under suction. It's not so much a weight loss procedure as it is a fat reducing and fat resculpting procedure. For patients with areas of stubborn fat but good skin quality, it's an extremely effective procedure. The most common areas of liposuction in my practice are the neck and jawline, the arms, the torso, the back, and the inner thighs and knees. Liposuction can be done asleep under general anesthesia or fully awake under local anesthesia. Typically in my practice, if there are focal areas of stubborn fat and the procedure length is short, I'm going to do this under local anesthesia and people tolerate it very, very well. Usually if it's a longer procedure with more areas of fat to be done, I do this under general anesthesia. What we do is we begin by making small incisions in strategic areas, and we introduce a small cannula and inject a solution called tumescent solution. Tumescent solution's something that reduces bleeding, reduces bruising, and improves the pain profile after the procedure. It also helps extract the fat and remove the fat. After this is injected into the body, we'll introduce a larger cannula that's under suction and it vibrates, and that's what extracts the fat from the body. Usually when we're performing liposuction, we're doing liposuction in the deep plane. But sometimes, especially in men nowadays that want more muscular definition, we're doing liposuction closer to the surface, more superficial liposuction. And this is called high definition liposuction, which is becoming very popular today. There is a perception amongst some patients that liposuction is not surgery, and this is wrong. So patients present and they say, oh, let's do a little liposuction of my abdomen now, and then when I get back from my summer travels, we'll do some more, and maybe in a year I'll do some more. It doesn't work that way. Liposuction needs to be done very well the first time, because every subsequent time you do liposuction, you bring in more scarring, and there's a higher chance of irregularities. For patients who have excess fat, but also have skin redundancy, they need liposuction in addition to another surgical procedure. So for instance, if someone comes in with fat excess of the neck, but they also have skin redundancy, they're going to get liposuction of the neck followed by a neck lift or a facelift. Similarly, in the abdomen, you reduce the thickness of the fat layer with liposuction before you do a full tummy tuck to address the laxity of the skin. The best liposuction candidates have very good skin quality. So liposuction addresses the fat layer, but it doesn't address the skin. So if you have good skin quality, you'll do liposuction, it'll reduce the fat layer, but then the skin will contract over top and you'll get a beautiful result. If you have skin redundancy or rectus diastasis with pregnancy, liposuction will decrease the fat layer, but it will actually exacerbate or make worse the skin redundancy. So the best patients for liposuction in isolation have good skin quality. Another thing that's important with liposuction is sometimes you can recycle the fat, and this is called fat grafting. So we extract the fat into a canister, we process it, and then we inject it into certain areas of the body that need more volumization. So the most common areas in my practice for this are for facelifts, where we do facial fat grafting, or for the breasts, where we inject fat into the breast to improve the volume, give them a natural breast augmentation without using an implant, the buttock to improve the shape of the buttocks, and the back of the hand to improve the dorsal skin of the hand and make it look healthier.